This was actually started in 2017 through a translational grant from the National Foundation for Cancer Research, which really helped accelerate the studies that we wanted to do to bring this forward. Some of the work had initially been done while at Columbia, the clinical trial with the molecule we're now working with in InterLeukin Therapeutics started there, now has evolved into new versions of this, and an interesting virus we call a cancer terminator virus. This virus will not affect normal cells, but when it enters a cancer cell, it selectively replicates and produces a protein that's secreted called a therapeutic cytokine. And this one is IL-24. When I started this, there was only up to IL-19, and I stopped counting at that point. But IL-24 is an interesting member of what's called the IL-10 gene family that selectively kills cancer. It's got really profound activity, both clinically as well as all of its preliminary studies look very promising to move it along. Basically, it's generated from a desire to develop improved technologies for treating metastasis. Metastasis in solid cancers, 90% of deaths from cancer in patients that have metastasis is because of this spread to distant organs. And that's always been an interest of mine. I've had, of course, family members that have succumbed to cancer, and we've now picked one of the most difficult cancers to start treatment with, which is called glioblastoma multiforme. This is a cancer where 95% of patients die very rapidly, less than 5 years. Recurrence after surgery is 7 months. So it's a real intractable disease, and there has not been impact. And part of the function of this company is to start with that devastating disease and then evolve into other cancers. This has been an amazing thrust forward for us. We just applied for what is called a Catalyst funding program from the state of Virginia, which is very, very competitive, and have received verification and actually $700,000 matching fund. So Aim High has put up $700,000. The state of Virginia has put up $700,000 now. That's $1.4 million. That will take us through preclinical toxicology, ready to now embark on a clinical trial. It's a group of outstanding scientists. I've been really fortunate to be involved with them for now probably 10 years, 11 years at least. And the science is exciting. There's avenues for collaboration and interaction. So I've worked on both fronts with NFCR now. I've worked on the pure research front, which is their NFCR funded programs, which have been for the last 11 years. And now this newer program that they've started through Aim High, which we've evolved into. The work that they supported helped make this possible to take us to the next level. This new funding will take us to the next level, which we hope is now treating patients and having a cure.